Let me ask you a question that many men think about but rarely say out loud. What actually happens if you ejaculate every single day? Is it healthy? Is it harmful? Could it improve your well-being? Or could it quietly affect your energy and performance over time? If you've ever wondered about this, you're certainly not alone. This is one of the most common questions I hear from men of all ages. It's a topic surrounded by myths, misinformation, embarrassment, and sometimes even guilt. Yet it plays a significant role in men's health, relationships, confidence, and overall quality of life. I am Dr. Sofia, and today I want to give you a balanced, science-based perspective. We're going to look at the potential benefits of daily ejaculation, the possible downsides, and most importantly, how to determine what works best for your body and your lifestyle. By the end of this discussion, you'll have a clearer understanding of the facts and feel more confident about making decisions that support your health. Before we dive in, it's important to understand one thing right away. There is no universal answer. Daily ejaculation is not automatically good, and it's not automatically bad. The impact depends on your overall health, your reasons for doing it, your age, your lifestyle, and how it affects your physical and emotional well-being. Some men feel relaxed, energized, and balanced with regular sexual release. Others may notice reduced motivation, lower desire, or certain habits developing that don't serve them well. The key is understanding the difference between a healthy routine and an unhealthy pattern. Many men were never taught how sexual health actually works. Instead, they grew up hearing conflicting opinions from friends, the internet, or popular culture. That's why it's important to focus on evidence rather than myths. Think of this conversation as a discussion between a doctor and a friend. My goal is not to judge your choices. My goal is to help you understand your body so you can make informed decisions with confidence. Let's start with one of the most noticeable benefits: mood improvement and stress reduction. After ejaculation, the brain releases several important chemicals, including dopamine, oxytocin, endorphins, and serotonin. These substances influence mood, pleasure, relaxation, and emotional stability. Endorphins act as natural pain relievers. Dopamine contributes to feelings of reward and satisfaction. Oxytocin promotes feelings of connection and comfort. And serotonin helps regulate mood. Together, they create a calming effect that many men experience immediately afterward. For some individuals, this can reduce stress levels, improve emotional balance, and create a greater sense of well-being throughout the day. Another commonly reported benefit is improved sleep quality. Many men notice that they feel sleepy after sexual activity or masturbation. This is partly because the body releases hormones that encourage relaxation and recovery. One of these hormones is prolactin, which increases after orgasm and is associated with feelings of satisfaction and restfulness. Combined with the calming effects of oxytocin and endorphins, this hormonal shift can help some men fall asleep faster and enjoy deeper rest. Better sleep often leads to better concentration, improved energy levels, and greater overall health. Daily ejaculation may also support healthy circulation. Sexual arousal increases heart rate and promotes blood flow throughout the body. During arousal, blood vessels expand, allowing more oxygen-rich blood to reach tissues and organs. This process helps maintain healthy vascular function. While sexual activity should never be considered a substitute for exercise, it does engage several physiological systems that contribute to cardiovascular health. Good circulation is important not only for heart health, but also for maintaining healthy erectile function as men age. One of the most talked about areas of research involves prostate health. Several large studies have suggested that men who ejaculate more frequently may have a lower risk of developing certain prostate problems later in life. Researchers believe that regular ejaculation may help clear substances from the prostate gland, reducing the buildup of inflammatory materials. While more research is always needed, these findings have generated considerable interest because prostate health becomes increasingly important as men grow older. It's important to remember, however, that ejaculation alone is not a guarantee of protection. Regular medical checkups, healthy eating habits, physical activity, and preventive care remain essential. Another potential advantage is support for the immune system. Some studies have found that sexual activity may temporarily increase levels of certain immune-related substances in the body. In addition, reducing stress through healthy sexual expression can indirectly support immune function because chronic stress is known to weaken the body's defenses. While daily ejaculation is certainly not a replacement for proper nutrition, exercise, sleep, and medical care, it may contribute to overall wellness as part of a healthy lifestyle. Now let's discuss the other side of the conversation, because daily ejaculation is not beneficial for everyone. One potential drawback is the development of compulsive behavior. There is a major difference between making a conscious choice and feeling driven by an uncontrollable urge. If sexual activity begins interfering with work, relationships, responsibilities, or personal goals, it may be a sign that the behavior has become unhealthy. Compulsive patterns can affect the brain's reward system and may lead to frustration, guilt, or loss of control. The important question to ask yourself is simple. Am I choosing this behavior, or does it feel like the behavior is controlling me? Another concern arises when ejaculation becomes the primary way of dealing with difficult emotions. Everyone experiences stress, loneliness, boredom, sadness, or anxiety. Sexual release can temporarily relieve those feelings, but it should not be the only coping mechanism. If a man relies exclusively on sexual activity whenever life becomes challenging, he may avoid addressing deeper emotional needs. Healthy coping strategies should also include exercise, meaningful social connections, hobbies, personal growth, relaxation techniques, and, when necessary, professional support. For men who are actively trying to conceive, daily ejaculation may present another consideration. Sperm production is a continuous process, but sperm concentration can decrease when ejaculation occurs very frequently. While this doesn't necessarily prevent conception, fertility specialists often recommend timing intercourse strategically during fertile periods. In some situations, allowing a short period between ejaculations may help improve sperm concentration. If fertility is a concern, discussing individual circumstances with a healthcare professional is always a good idea. Some men also report reduced sensitivity or diminished excitement when sexual release becomes excessively routine. The brain naturally adapts to repeated stimulation. Over time, what once felt highly rewarding may feel less exciting if there is little variation or anticipation. This doesn't happen to everyone, but for some men, taking occasional breaks or focusing more on emotional intimacy can help restore desire and enjoyment. Another potential issue involves sexual performance habits. If masturbation consistently occurs in a rushed manner, the body may become conditioned to respond very quickly. Over time, this can sometimes contribute to difficulties with control during partnered intimacy. The solution is often simple: slow down, be mindful, and focus on quality rather than speed. Developing awareness and control during sexual activity can improve confidence and satisfaction in the long term. So what is the takeaway from all of this? The answer is not found in a specific number. The real question is how daily ejaculation affects you personally. Does it leave you feeling relaxed, energized, and emotionally balanced? Or does it leave you feeling distracted, fatigued, unmotivated, or dependent on it as your primary source of relief? Your body's response provides valuable information. Pay attention to your energy levels, mood, sleep quality, motivation, relationships, and overall well-being. If daily ejaculation supports your health and fits comfortably into your life, it may be perfectly reasonable. If it begins creating problems or interfering with your goals, it may be worth adjusting your habits. The key is self-awareness rather than rigid rules. Most importantly, don't allow shame or misinformation to guide your decisions. Sexual health is a normal part of overall health. Asking questions about it doesn't make you weak, strange, or unhealthy. In fact, it shows that you're taking an active interest in understanding your body and improving your well-being. Remember, your health is about balance. Daily ejaculation can be beneficial for some men and less beneficial for others. The goal is not to follow someone else's rules, but to understand what helps you feel your best physically, mentally, and emotionally. Small adjustments, thoughtful choices, and honest self-reflection can go a long way toward maintaining confidence, vitality, and overall wellness. I'm Dr. Sofia, and I hope this discussion helped bring clarity to a topic that many men wonder about, but rarely discuss openly. Take care of your body, listen to its signals, and continue learning about your health. The more informed you are, the better equipped you'll be to make decisions that support a stronger, healthier, and more confident future.